And we're live. Dr. Della Parker in the house, here from Stellar Health and Wellness. We're going to talk about thyroid a little bit today and the thyroid adrenal connection. It's been coming up a lot in practice, and so when you find yourself repeating something over and over again, we got to put it out there so everybody can hear about it. So hypothyroidism, most common type of thyroid dysfunction that I see, and that just means low thyroid hormone hanging out, okay? So why do we need thyroid hormone? Well, super important. Every single cell in our body has a receptor for thyroid hormone, and so that basically means that the symptoms are all over the map when you have low thyroid function, and that is definitely what we see. So some of the symptoms of low thyroid function are fatigue, especially can't get out of bed in the morning type of fatigue, weight gain that's unexplained. Not because you went on a binge of Dorito Twinkie eating, but you can't explain the weight gain. All of a sudden, the same things that you're doing are ineffective and the weight's piling on. Metabolism is just slowing down. Constipation, dry skin, brain fog. Like you walk into a room and you're like, wait, what am I doing in here again? Yeah, low thyroid function. Depression is a huge one. What am I forgetting? Hair loss, your hair falling out, your fingernails really, really brittle, not because you've shellacked your nails 100 times, but because your nails are just super brittle. Those are some really common hypothyroid symptoms. So I'm sure you can Google that, you read your symptoms, and you go to the doctor, say, hey, I think I got a thyroid issue, I'm gaining weight, I'm super tired, help me out. And your doctor tests TSH, thyroid stimulating hormone, and says, nope, you're all good. Hit the gym, see you later, right? This is so common. People come in constantly saying, well, my doctor said my thyroid is normal. Well, let me tell you what that really means. First of all, when you just test thyroid stimulating hormone, I could give a shit. That is not telling us how your thyroid is functioning. TSH is the top of the food chain. So we're expecting this number that is basically just, a measure of what's going on downstream. However your hormones are functioning in your bloodstream should do a feedback loop to the top of the food chain. That's your TSH. So if all those signals are working and the feedback loop is working properly, we can really rely on TSH. But everybody's got jacked adrenals, right? Take our How Jacked Are Your Adrenals quiz. You can find it. We'll put links everywhere. Take that. So that's going to tell us how jacked your adrenals are. If your adrenals are jacked, we got some cortisol happening, and that is interfering with that feedback loop. Estrogen and other hormones also interfere with that feedback loop. Hello, we're freaking crazy stressed out moms. That feedback loop is jacked. I'll tell you right now, I see it probably 70% of the time that the TSH number is not a true predictor of the hormones downstream in your blood. And so we want to evaluate thyroid completely, make sure you're getting a complete lab workup to identify what hormones are in your blood, you're converting to the active thyroid hormone, that you're not reversing your active thyroid hormone. All that stuff is super important. Naturopath can totally help you out. Aside from that, let's talk a little bit more about adrenals. So thyroid and adrenal sitting in a tree, Kissing. So thyroid and adrenals, they're homies. They ride or die together. So like I said, busy, tired moms, we are, we're adrenally jacked. So we've got either a ton of cortisol because we're super stressed out, or we've been so stressed out for so long that our adrenals have completely tanked and we have no cortisol. Either way, when our adrenal glands are struggling, they are pulling down thyroid function with them. So even if you do get identified with having hypothyroidism and you're taking a thyroid medication, if your adrenals are still pulling down on thyroid, you can only go so far before you need to support your adrenals to be able to up-level your thyroid. They work together. Think of like window washers. You can pull up one side, but the other side's got to come up too if you ever want to bring them both to the next level to move up. So thyroid and adrenal, in my opinion, super important to be supported together. And how do we figure this out? Guys, muscle testing. I could sit here and hear your story and tell you what is my favorite thyroid or adrenal herb for you. Or I could ask your unique body via muscle testing using a treatment selection method to help us select the best treatment for your unique system where you are. And then we know that we're giving you the right things that your body is going to respond to the best. And that's what we do here at Stellar. So We are looking at you as a unique individual. We're not treating just hypothyroidism and here is my protocol. We want to treat you as an individual. Protocols out the window, all right? So I just wanted to give you that tidbit. Make sure that you are getting your thyroid labs checked completely. Make sure that you're having your adrenals looked at, because a lot of these symptoms, what do they say? Thyroid function has to be 70% depleted before it's gonna spill over onto lab work. So we wanna identify when things are like headed down the wrong path and help fix that, restore function before we even see those lab numbers looking bad, okay? And so that's where naturopaths can come in to help with that preventative medicine. I know it doesn't sound sexy, but we wanna prevent disease from happening and get your energy back, get your metabolism back. You know, brain fog, hello, mom brain, that's, you know, we can get rid of that. It doesn't have to be that way. That doesn't have to be you. We can make this all better. So totally hit up that How Jacked Your Adrenals quiz. We'll put the link on here for you, and share this with busy, tired moms that are haggard. You know, we all struggle with the same issues, and I think that we're not getting the support that we need. So you need to take charge of your health and go find it. StellarHW.com is where you can find more information. And thanks for joining me. We'll check you later.